Hi everyone! Welcome back to my channel! Sa mga hindi pa nakakilala sa akin, I am John Alfredo Diego Pueblo, RMT. So sa mga kasamahan ko dyan, mga katusok, kamusta kayo dyan? Okay, so sa mga hindi pa nakapag-subscribe sa aking channel, please do like and subscribe and don't forget to click the bell button below para masubaybayan nyo ang aking video. In this segment, okay, so this is intended for all medical technologists, especially to all the students who will be taking up clinical chemistry. In this segment, I will be sharing to you some facts about clinical chemistry and of course, the must-to-know questions about clinical chemistry. So, ang source natin dito, and of course, hindi natin makakalimutan yung book natin na si Henry's, okay? And of course, yung main reference natin dito ay si Clinical Chemistry by Bishop. And of course, the reviewer books of Miss Rodriguez. And some of our recall questions from at Review Center. Okay, so let's start. By the way, what is clinical chemistry? Clinical, okay, came from the Greek word means klein, meaning bed. Okay, while chemistry, it is the science that deals with the elements, their compounds, and the chemical structures and interactions of matter. And of course, in short, clinical chemistry is a basic science that utilizes the specialty of chemistry to study human beings in various stages of health and disease. It is an applied science when analyses are performed on body fluids or tissue specimens to provide important information for the diagnosis or treatment of diseases. Okay, that is a clinical chemistry. Don't forget that. Okay, so question: what do you call a device that is used to calibrate a centrifuge? Okay, so ano yung device na ginagamit to calibrate the centrifuge? The answer is tachometer. Okay? What do you call a test for hemoglobin F? Okay, so what do you call a test for hemoglobin F? The answer is Kleihauer-Bethke test. Okay, so Kleihauer-Bethke test. Okay, next question. What do you call a combination of bilirubin plus albumin? Bilirubin plus albumin. The answer is delta bilirubin. Don't forget, delta bilirubin. Delta bilirubin. Okay. So, next, what do you call estrogen in a pregnant woman? What do you call an estrogen in a pregnant woman? The answer is estriol. Para hindi makakalimutan, don't forget these mnemonics. Try pa more. Try mo maging preggy. Okay? So, estriol. Okay? Walay na naman yung joke natin, no? Try pa more. Try mo maging preggy. Okay? So, what do you call an estrogen in pregnant women? The answer is estriol. Try pa more. Okay? So, next is, it is a disease characterized by excessive resorption of bone followed by a new bone formation. It is a disease characterized by excessive resorption of bone followed by a new bone formation. So the answer is Paget's disease or Paget's disease. Okay? So para hindi makalimutan, we have also another mnemonics there. No? Puro buto. So ugly. So pangit. So the answer is Paget's disease. Okay? So hindi pangit, no? Paget's disease or Paget's disease. So puro buto. So ugly. So pangit. Okay? So the answer is Paget's disease. Okay, next is in a diabetes mellitus, no, what is the FBS value, no, that you consider that the patient has already a diabetes mellitus? So the answer is greater than 126 mg per dl, no? Greater than or equal to 126 mg per dl. But take note, no? There must be at least 2 tests to diagnose that the patient has a diabetes mellitus. Okay? So, next question, no, the max to know question in clinical chemistry. So, this is a metabolic defects, no, in Wilson's disease. Okay, so Wilson's disease. This is a metabolic defects which leads to neurologic and other problems, also characterized by the low amount of what? Okay, so Wilson's disease is a metabolic defects which lead to a neurologic problems, no, and other problems. It is also characterized by the low amount of what? So, this is a very common question in clinical chemistry. The answer is ceruloplasmin. Okay, para hindi makakalimutan, don't forget this mnemonics, no? Siraulo. Okay? Siraulo. Kasi neurologic problem eh. Okay? Siraulo. So, meaning, ceruloplasmin. Okay, so walay na naman. Okay, next. What is the value of your high HDL cholesterol? So, what is the value of your high HDL cholesterol? The answer is greater than or equal to 60 mg per DL. Okay? Greater than or equal to 60 mg per DL. Okay, so this is a recall question, no, from the board examination. So, it is an odor of garlic and metallic taste. It is an odor of garlic and metallic taste. So the answer is arsenic. Okay? So odor of garlic and metallic taste, the answer is arsenic. So don't forget the garlic and metallic, di ba? So end of the arsenic is C. No? Garlic, metallic. In short, the answer is arsenic. Okay. Next is, what do you call an increase of urea in the blood? What do you call an increase of urea in the blood? The answer is azotemia. Azotemia. Okay. Next, what gauge used in an arterial, okay, blood collection? What gauge of your needle that is used during arterial collection? The answer is gauge 18. So, please take note that before doing so, let's do the Allen test. So, Allen test, guys, is a first-line standard test used to assess the arterial blood supply of the hand. Okay, so before performing arterial test, okay, or arterial puncture, we will be doing first an Allen test. Okay, next. Please take note these guys, no? Notes to remember, specimen consideration and patient preparation. Okay, so during fasting blood sugar, no? Fasting blood sugar should obtain after how many hours of fasting? Please take note, after 8 to 10 hours of fasting. Okay? 8 to 10 hours of fasting. Whole blood give approximately 10 to 15% glucose level than serum or plasma. Whole blood gives approximately 10 to 15% glucose level than serum or plasma. Please take note that serum is appropriate for glucose analysis. Serum is very appropriate for glucose analysis if it is separated from the cells within 30 to 60 minutes. Please take note, 30 to 60 minutes after blood collection. Okay? It is very appropriate for glucose analysis, no? From the blood, after the blood collection, it must be separated 30 to 60 minutes because when the blood does not been separated, glucose is metabolized at room temperature at the rate of 7 mg per dl per hour. So meaning pag hindi natin sila masiseparate, yung blood, whole blood natin, no? Your glucose has been metabolized by 7 mg per dl per hour. So meaning if you have a high glucose level, no, pag hindi mo sila na-separate, there must be a false result. Okay? So there must be a false result. Therefore, you must be separated 30 to 60 minutes. Okay? Before testing the blood glucose. Okay? So, this must be an interesting. Did you know that CSF or cerebrospinal fluid glucose is approximately 60 to 70% that of plasma concentrations, meaning mas mataas yung concentration ng glucose level sa ating CSF compared sa blood. Why? Because our brain needs a lot of glucose. Okay? So blood glucose should be obtained approximately 1 to 2 hours before the spinal tap. Before getting blood or before getting CSF fluid, okay, cerebrospinal fluid, no, samples, you must have blood collection 1 to 2 hours before getting a spinal tap. Okay, please take note that 1 to 2 hours before the spinal tap. Okay, next. So there are some categories of fasting blood glucose or plasma glucose. There are categories of fasting plasma glucose. So the normal plasma glucose or the plasma glucose value is less than 110 mg per dl. Don't forget, less than 110 mg per dl. The impaired fasting glucose naman, guys, or the impaired plasma glucose, the fasting plasma glucose niya is greater than or equal to 110 mg per dl and less than 126 mg per dl. While the provision diabetes diagnosis, the fasting plasma glucose is greater than or equal to 126 mg per dl. Okay, don't forget that. Okay, so next is Pipette classification. Okay, so let's talk about Pipette's classification because in clinical chemistry section, we are using pipettes daily. Okay, so there are classification of pipettes. Number 1 classification is classification in their calibration mark or design. Number 1 classification in terms of calibration marks or design. Number 1 is to deliver or TD. It delivers the exact amount it holds into a container. So, it delivers the exact amount that holds into a container. Okay? Number 2 classification is to contain or TC. It holds particular volume but does not dispense the exact volume. Okay? So, to contain, it holds particular volume but does not dispense the exact volume. Okay? So, that's one classification, no? Calibration marks or design. So, it classified into 2, to deliver and to contain. Next is their drainage characteristics. Okay, so number 1 is blowout. Blowout. It has a continuous etch ring on top of the pipette. So meaning, mayroon siyang etch ring in top of the pipette. Exact volume is obtained when the last drop is blown out. So meaning, lahat ng mga volume, lahat ng mga liquids na na-aspirate ng pipette na yun is exact na until the last drop. Okay, so yun tinatawag siyang blowout. Kasi pag i-blow out mo yung lahat ng amount na nandun sa loob ng pipette, so that is the exact amount of the volume, no, na inyong i-measure. Next is the self-draining. So it has the absence of etch ring. So meaning wala siyang etch ring. Okay? So liquid is allowed to drain by the gravity. Okay? So always remember, what is the calibration medium for the TD pipettes? The answer is the calibrating medium for TD pipette is the distilled water. And mercury naman is for TC, no? Holds particular volume pipette, okay? So distilled water is for your TD, while mercury is for TC. Okay? So TD for delivers the exact amount, TC to holds particular volume. Okay? So the calibration, don't forget the calibration, okay? For calibrating medium, distilled water for your TD, mercury for your TC. Class A pipettes naman do not require any calibration. Please take note, Class A pipettes do not require any calibration. Plastic pipette tips are primarily made of polypropylene. Don't forget that. acid dichromate. Okay, acid dichromate is used for the cleaning solutions of glasswares. What is the gold standard for cholesterol determination? The answer is Abel-Kendall. Okay, Abel-Kendall, gold standard for cholesterol determination. Don't forget this. Our mnemonics, ang taba mo naman, Abel. Okay, di ba? Cholesterol, ang taba. Ang taba mo naman, Abel. So, meaning, Abel-Kendall. Abel-Kendall is the gold standard for cholesterol determination. Okay, so I just want to share to you guys the order of draws for evacuated tubes and syringe. These are the most common. Even in hematology, magamit nyo to siya na notes. Okay, so, for blood collection tubes, okay, for blood collection, the order of draw is, number 1 is yellow, okay, yellow color tube, yellow top, okay, so for blood culture tubes, so it must be sterile. Next is light blue stopper, it contains trisodium citrate. Next is for your serum tube, white or with or without clot activator or gel separator, serum tube. Okay, so next is green stopper. So heparin, lithium heparin, sodium or ammonium. Okay, so next is lavender or the purple stopper. It contains EDTA. Next is gray stopper. Okay, sodium fluoride and potassium oxalate or iodoacetate and heparin. So either of these. Okay, so 10 common errors in specimen collection. Okay, so what are the 10 common errors in specimen collections? So, number 1 is misidentification of patient. Number 2, mislabeling of specimen. Number 3, short draws or wrong anticoagulant or blood ratio. Number 4, mixing problems or there's a clot in your blood collection. Number 5, wrong tubes or wrong anticoagulants. Number 6, hemolysis or lipemia. Number 7, hemo concentrations from prolonged tourniquet time. Number 8, exposure of light or extreme temperature. Number 9, improperly timed specimens or delayed delivery to laboratory. And the last one, number 10, processing errors, incomplete centrifugations, or incorrect login, and of course, improper storage. So those are the 10 common errors in specimen collection. Please take note of this. In your tourniquet application, tourniquet must apply 3 to 4 inches above the site. Okay, there must be 3. Okay, so 3 to 4 inches above the site of your venipuncture. Kung saan nyo tutusukan yung patient ninyo, 3 to 4 inches. Please take note, ito yung palaging lumalabas sa board exam. If blood pressure cuff is used as tourniquet, kung walang tourniquet, ginagamit natin is yung blood pressure cuff, it is inflated 60 mm Hg. Okay, please take note, 60 mm Hg. Studies have shown that reusable tourniquet have a potential to transmit bacteria. Okay? Have a potential to transmit bacteria, including methicillin-resistant Staphylococcus aureus or MRSA. Okay? Okay. So, needle specifications and bevel positions. Okay? The gauge of the needle is inversely related to the size of the needle. The larger the gauge number, the smaller the needle bore and the length. Okay, so kung mataas yung gauge, the smaller the bore. Okay, so saan yung gusto niyo? Yung malaki or yung maliit? Okay, so the 21 and the 22 gauge needles are used for blood collection. The 23 gauge are for children's and the 21 to 23 and 25 gauge for butterfly needle. Don't forget that. Needle length is 1 or 1.5 inch. Don't forget, needle length 1 or 1.5 inch. Okay, in your butterfly needle, 1/2 or 3/4 inches for your butterfly needle. 21 gauge naman ang ginagamit, is considered to be the standard for most routine adults anticubital venipuncture. Don't forget, the standard needle used is the 21 gauge. 21 gauge is the standard needle used. Okay, so what do you call the first milk that comes out in a mother's breast? What do you call a first milk that comes out in a mother's breast? The answer is colostrum. Okay? Human milk, which is designed to promote infants' health, is much lower protein, calcium and sodium, and higher in mono and polyunsaturated fats, carbohydrates, folates, and vitamin C. That's the reason why for those who have babies, breast milk is very recommendable for those infants. Okay? So, yun yung palaging ina-advise ng mga physician that breastfeeding is the best of all milk. Okay? So, let's go back to centrifuge. Okay? Kasi palaging lumalabas. The question is, how often we calibrate centrifuge? Okay? How often we calibrate the centrifuge? The answer is quarterly. Okay, so how often we disinfect centrifuge? How often we disinfect centrifuge? The answer is weekly. Okay, so what is the normal person's HbA1c? What is the normal HbA1c level of a person? The answer is less than or equal to 5.5%. Okay, so in short, the normal HbA1c level, para hindi makalimutan, 555 sardines. Joke lang. Okay? So, 5.5%, okay? 5.5% or less than or equal to 5.5%. Okay? Pag diabetes mellitus na siya, is greater than or equal to 6.5%. Pag pre-diabetic patient siya, is 5.6 to 6.4%. Okay? What are the objectives of quality control? The answer is MOR, Radio for Life. Joke lang. Okay, so MOR is a short or abbreviation for the objectives of quality control. The M stands for check machine stability, O stands for operator's error, and R stands for reagent quality. So that's why MOR for life. Don't forget that. MOR, check machine stability, operator's error, and reagents control. Next is, what do you call an accumulation of bilirubin in the brain? The answer is kernicterus. The answer is kernicterus. Common questions at lumalabas sa board exam. What is the ratio of sodium hypochlorite to water to make a disinfectant? The answer is 1:10. Okay, Zonrox. Okay, you can use Zonrox. Okay, so the most popular brand is Zonrox, no, na sodium hypochlorite solution. Ito, common. So may joke, may sinabi, during the time, college days, sabi ng teacher namin, ng professor namin, ano yung iinumin mo na gamot pag gusto mong luluha ng dugo? So, there is an answer. Okay, so associated to Reedman syndrome, the answer is vancomycin. Antibiotic used for MRSA, no methicillin-resistant Staphylococcus aureus. The answer is vancomycin. Pag iniwan ka ng boyfriend mo or girlfriend mo, uminom ka ng vancomycin para balikan ka niya. Dahil luluha ka talaga ng dugo sa vancomycin. Okay? That's a joke lang ha. So, what is the gold standard for drug testing? The answer is GCMS, gas chromatography, mass spectrophotometry. Spectrometry. Gas chromatography, mass spectrometry. Okay? So, a BMI of 18 is considered to be underweight, overweight, or healthy, or obese. The answer is underweight. Because guys, below 18.5, no? Below 18.5 of BMI considered to be underweight. 18.5 to 24.9 is considered to be healthy. 25 to 29.9 considered to be overweight, and 30 or up considered to be obese. Okay, the answer is underweight, no? A BMI of 18. Type 2 diabetes mellitus. So, this is a type of diabetes wherein the body loses its sensitivity to insulin. So, if the question is type of diabetes, what type of diabetes wherein the body loses its sensitivity to insulin? The answer is type 2 diabetes mellitus. Uy, di ba yung type 1, wala kasing insulin kasi sinira yung beta cells na gumagawa ng insulin. So, kumbaga inherit or kumbaga from bata pa, diabetes siya kasi hindi na siya makagawa ng insulin. So, that's the type 1. So, wala kang insulin kasi sinira na ng beta cells yung gumagawa ng insulin. Okay? So, type 1 also known as juvenile diabetes, meaning since pagkabata ka lang, may diabetes ka na, or insulin-dependent diabetes. Ito, last must to know about clinical chemistry. Okay, so in myocardial infarction or in MI, so what is the first enzyme to increase? The answer is CKMB. What is the first cardiac markers to increase? Is your myoglobin. And of course, what is the specific marker in serology? Troponin I or TROP-I. Okay, serology or clinical chemistry, mostly ito ginagawa. Okay, so in myocardial infarction, the first enzyme to increase your CKMB. What is the first cardiac marker to increase? Myoglobin. And what is the specific marker for myocardial infarction? The answer is troponin I. Okay, so that's all our massive questions about clinical chemistry. I hope you enjoy and you learned a lot. So sa mga hindi pa nakapag-subscribe, please don't forget to subscribe. And of course, don't forget to share to your classmates and to your friends sa mga medtechs, diba? Schools, and to my fellow medtechs. Hope this will be a review for us, no? Para hindi naman natin makakalimutan yung mga basic questions about clinical chemistry. So kung may mga questions kayo about clinical chemistry, please don't hesitate to write down your questions